I really wanted to congratulate you and Blanchard for winning an Excellence in Treatment Award this year. A lot of our centers take a couple of years to get up to 5-star territory. Why do you think is the secret that has enabled you to be so effective right off the bat?
Our work with families is quite different.
In what way? What do you do differently with families?
Absolutely. I think that overwhelmingly family programs and family departments are 20 to 30 years behind. So with patients that don't have a frontal cortex, we say, like NIDA, motivation and want going into treatment has no bearing on overall outcome. Compliance does in the beginning. It's called behavioral activation. It's like you can act your way into healthier thinking. So 12 steps, this is why they say, they have it all the time. They say, come in here and fake it until you make it.
Right.
Come in here and comply until you have your brain heals, and then you want it. And I clarify it with patients and families. I say, if you're going to live a lifetime of long-term recovery, yes, you're going to have to want it. You're going to have to be motivated. You're going to have to engage. But in the beginning, when your brain is not working, when you have cognitive diminished capacity, and we know that these drugs affect the dopamine, the motivation part of your brain is dysregulated. Why in the world does any professional tell them you have to be motivated to make it work? And so we need compliance, and that's where you empower families, because they can set the boundaries, healthy boundaries that you would ask any healthy that influence the compliance. Well, we know that works. We have the evidence of like licensure professionals that force compliance. With families who have the same similar impact on their brain, it's very hard to find compliance for them. But we do. Like, for instance, one of the things that because we're family-focused treatment, it's on the beginning. And one of the things that we teach, and the answer to your question is, professionals shy away and avoid from having very compassionate yet very uncomfortable conversations with families. They just shy away from it. And when in actuality, it's an enormous disservice. It's just because it's uncomfortable. You think when that doctor diagnosed me, you think it was a comfortable conversation to tell an 18-year-old he was going to die? But if he didn't do it, that would have been a disservice. And so we have those conversations, and they'll say, I want an update. And we say, and unfortunately, in order to get our updates, you will have to come to our Thursday night group and our Saturday night group, and you need educational therapy and some things in order to be able to handle this in a healthy way. Well, I'm not doing it. I hear you. I mean, I do. And I'm not going to give you the update. I mean, where customer service is not number one. We do customer service, but my ultimate goal is to have compassionate, uncomfortable conversations that lead you and your family to become happy, healthy, and more connected. And so we apply leverage on the families that force their compliance. And for that reason, if they learn, we know they'll set boundaries, then clients will stay in treatment longer. And if they stay in treatment longer, we have the evidence base is better. And Joanna, your research has been very helpful at me identifying when we have gotten away. And whenever I look at the patient's disruptive behavior symptoms, I don't look at the direct contact of the clinical program. 100% of the time, I will look at how much family contact, and it is directly correlated.
Really? Wow.
Yep. Like when somebody leaves ACA, I guarantee you that therapist did not call the family in the first 3 weeks. They did not tell them they had to attend the groups, and they did not attend the work. I guarantee you.
Wow.
And so that's what we do differently. It's our program and dual diagnosis and individualized and EMDR and all that stuff is the same as everybody's. It's what we do with the families that's different.
Wow.